Namaste Bitia, myself JV Neha Saini from Physiotherapy and Diagnostics, Jyoti Vidyapeeth Women's University. Here I am going to tell you about the anatomy of ulna. Ulna is one of the bone in the forearm and it lies medially. On the lateral side we have the radius. This is radius, and on the medial side we have ulna. This is the radius lying on the lateral aspect of the forearm. Ulna is a long bone, that is why it has been divided into three parts: upper, middle and lower part. So this is the upper end, this is middle and this is the lower part. At the proximal part we have some interesting projections, processes and notches. So this is the anterior view and this is the posterior view of the ulna. Now at the proximal end we have two notch, that is, first is the radial notch. So this area which is highlighted, this is the radial notch. Why it is known as radial notch? Because here the head of the radius articulates and forms superior radioulnar joint, that is proximal radioulnar joint. So this is the radial notch. Here we can see the articulation of the head of radius with the radial notch and formation of proximal radioulnar joint. Another notch at the proximal end which is highlighted in this image, this is the trochlear notch. So this trochlear notch articulates with the trochlea of humerus and forms the elbow joint. So this is the trochlea which is highlighted in the humerus lower end, and it articulates with the trochlear notch of the ulna, and this joint permits flexion and extension movements, which are the movements of elbow joint. Now this is the olecranon process. This olecranon process is having attachment of triceps brachii muscle on its superior surface. So this triceps muscle is inserting on the olecranon process on its superior surface. This olecranon process articulates with the olecranon fossa, which is lying on the posterior aspect of the lower end of humerus. So in the humerus at the lower end we have highlighted the olecranon fossa. Here we can see the olecranon process is articulating with the olecranon fossa on the lower end of humerus at its posterior surface. Another process at the upper end of the ulna is coronoid process. This coronoid process articulates with the coronoid fossa at the lower end of humerus on its anterior surface. So this coronoid fossa lies on the anterior surface of lower end of humerus, just above the trochlea. So this coronoid process of ulna articulates with the coronoid fossa of the humerus during formation of elbow joint, that is especially during the flexion of the elbow joint. The distal end of ulna is much smaller than the proximal end and it helps to form the wrist joint, but does not actually participating in the formation of wrist joint. So at the lower end of ulna it articulates with the lower end of radius and forms the distal radioulnar joint. At the upper end it also articulates with the radius and forms proximal radioulnar joint. So at the distal end we have this rounded head. This rounded structure is known as head of ulna. It is articulating with the lower end of radius and forms inferior radioulnar joint, or we can say distal radioulnar joint. Another structure at the lower end is this small process which is known as styloid process of ulna. So in the radius you also have styloid process. In the ulna we are also having the styloid process. Now the muscles which are attached to the ulna. So at the upper end we have flexor digitorum superficialis. As we can see in the image, it is just lying lateral to the ulnar tuberosity. So this is the ulnar tuberosity, and on the medial margin of this we have the origin of flexor digitorum superficialis and pronator teres. So these two muscles are the muscles of front of forearm. So this is the pronator teres arising from the medial epicondyle of humerus as well as from the medial margin of the coronoid process of ulna. So, and it is inserting on the middle 1/3 of the lateral surface of radius. So this is the pronator teres. Another muscle attached on the ulna at the upper end is the brachialis muscle. This brachialis muscle arises from the anterolateral as well as anteromedial surfaces of the lower 1/3 part of the humerus and inserts on the ulnar tuberosity. Ulnar tuberosity is lying just on the anterior surface of the coronoid process. So this is the insertion of the brachialis muscle on the ulna, and origin of the brachialis muscle is from the humerus. This is the supinator muscle, arises from the supinator fossa and the supinator crest. So supinator fossa is a depressed area just lower to the radial notch. This is the radial notch. Just lower to it there is a depressed area which is highlighted over here. This is the supinator fossa, and the posterior margin of the supinator fossa is known as supinator crest. These two areas gives origin to the supinator muscle. It is a muscle of the back of forearm. Another muscle is the flexor digitorum profundus. It arises from the medial aspect of the olecranon process and proximal 3/4 of the medial as well as anterior surfaces of the ulna. So this muscle is having vast origin from the ulna. That is, it is covering the anterior as well as medial surfaces of the ulna, upper 3/4 of the medial as well as anterior surfaces of the ulna, along with the medial surface of the olecranon process of the ulna. So this is the bulkiest muscle, and it is sending 4 tendons for medial 4 fingers for the flexion of interphalangeal joints as well as proximal as well as distal interphalangeal joints. Next muscle is the pronator quadratus muscle. It is arising from the lower 1/4 part of the anterior surface of ulna. So here we can see the pronator quadratus. Next muscle is the triceps brachii muscle. It is inserting on the superior surface of the olecranon process of the ulna. So in the image we have given the attachment of the triceps brachii on the superior surface, which is highlighted with the red color. So this is the insertion of triceps brachii muscle on the superior surface of the olecranon process of the ulna. The main action of this muscle is the extension of the elbow joint. Another muscle at the upper end of ulna is the anconeus. It is attached on the posterolateral aspect of the olecranon process of the ulna, and it is arising from the posterior surface of lateral epicondyle of humerus. It is a weak extensor of the elbow joint. It is a small muscle at the back of the forearm. Now, on the posterior border of the ulna, we have an aponeurotic attachment of 3 muscles. These are flexor digitorum profundus, flexor carpi ulnaris, extensor carpi ulnaris. So these muscles are taking common aponeurotic origin from the posterior border of the ulna. It is highlighted in the diagram. Next muscle arising from the posterior surface of proximal 1/3 of the ulna is the abductor pollicis longus. So this muscle takes origin from the ulna, and it is for the abduction movement of the thumb. Another muscle which is arising from the middle 1/3 of the posterior surface of the ulna is extensor pollicis longus. It is a muscle for extension of the thumb. It is another muscle of the back of forearm. Next is the extensor indicis. It arises from the lower 1/3 of the posterior surface of the ulna, and it is for the extension of the index finger. Now come to the applied. This is the olecranon fracture. When a person falls directly on the olecranon process, it may lead to the fracture of it. So this is the olecranon fracture. Another is MADELUNG's deformity. In this, the lower end of radius does not dove normally, which results in posterior dislocation of lower end of ulna. This is the MADELUNG's deformity. So in this image, we can see how it appears. Another is Monteggia's fracture. Monteggia's fracture is the fracture of proximal end of the ulna and displacement of superior radioulnar joint. So this is the Monteggia's fracture. Now the questions related to this topic. First is write short note on the attachments of upper end of ulna. So in this we have to mention about what are the structures at the upper end of ulna and what are the attachments over here. And in this we have to also draw the diagrams. Second question is Monteggia's fracture. So in this we have discussed the applied right now. You include that. Now this is the exercise for your files. You have to draw this diagram and label all the structures which are demarcated, and you can use only black pencil or black pen for drawing this diagram and highlighting all these structures. Next exercise for your file is you have to draw this diagram, the well labeled diagram for the attachments of the ulna on the anterior as well as posterior surface. And for origin use orange color, and for insertion use sky blue color. Use only pencil colors, nothing else. So this completes our topic, the anatomy of the ulna. Thank you.